Good evening, I'm Prasad Michael and you're watching Kini News, the show that brings you today's biggest stories. The third phase of the MCO will end tomorrow and soon we'll be in the fourth phase, and even with the order extended, we're a long way to go from putting an end to Covid-19. Malaysia continues to report a growing number of recoveries from Covid-19, with 95 patients being discharged on Monday. With one more day to go before the nation moves into the fourth phase of the movement control order, Malaysia still hasn't been able to reduce the number of new Covid-19 cases to a single digit. Health Ministry Director General Dr Noor Hisham Abdullah reported 40 new cases today, putting the number of active cases to 1,764. The number of active cases is less than half of the number of recoveries, which is approaching 4,000. Malaysia also reported one new death, bringing the death toll to 99.
And we have actually looked into movement control of 1, 2 and 3. The most important is actually to flatten the curve. And what we have seen is that we succeeded to flatten the curve. And now we are in the phase of recovery. And you see for the last 1 week, we have 2 digits. And that shows that our MCO works, and but it's not going to end COVID-19. So we anticipate that perhaps the COVID-19 will continue in terms of the infection, but we need to contain and control the infection.
The nation's top health official also revealed that hospitals currently have sufficient supply of personal protective equipment for frontliners.
So far, we do not have any issues with regards to PPE, and the supply is enough, and there's no shortage at the moment. The procurement is ongoing. So all the hospitals, we have actually a monitoring system in place, and so I would say that I think we have enough PPE.
Dr Noor Hisham also called on the public to donate blood, as the supply usually reduces during the month of Ramadan.
So what we 30% shortage is what we are facing now, but we encourage those who want to go to the hospital, for example, and they can come to the blood bank in the hospital for donation. So that's not an issue. And then we have discussed this with the IGP. Those who want to go to the hospital, that's not an issue, because even the roadblocks and all that, you inform them. I think once you go to the hospital and then once you have donated the blood, then we will give you a letter in terms of the blood donation campaign and etc.
When it comes to compliance to the movement control order, people have questioned whether there are 2 different rules, one for ordinary Malaysians and the other for those with political connections. According to our Senior Minister, it's the same for all. Senior Minister Ismail Sabri Yaakob revealed today that over 1,000 students who have been stuck on campus since the movement control order came into effect will finally be on their way home.
Untuk kumpulan yang pertama ini, sebanyak 1,128 pelajar IPTA dan IPTS di bawah KPT akan mula bergerak pulang ke kampung halaman masing-masing, iaitu bermula pada malam ini.
Ismail said the buses will be sanitized after each trip.
Proses penghantaran pulang malam ini akan melibatkan 9 universiti dan 49 bas ke 17 destinasi. Jadi bukan saja bas yang akan disanitasi, tetapi bagasi pelajar juga akan disanitasi sebelum mereka berlepas.
Commenting on a separate issue, Ismail said all those detained for violating the movement control order will be subjected to the same procedures by the police.
Setiap yang ditahan mesti akan diambil keterangan. Sebab jika nak dibawa, yang menentukan dibawa ke mahkamah atau tidak bukan polis. Polis setelah mengambil keterangan akan menghantar IP ataupun investigation paper ataupun kertas siasatan ke Jabatan Peguam Negara. Dan Jabatan Peguam Negara lah yang akan menentukan sama ada individu tersebut didakwa di mahkamah ataupun tidak.
Previously, several quarters have alleged selective policing and prosecution for breaching the MCO. Last week, police said they've recorded the statement of Nurul Hidayah, the daughter of UMNO President Ahmad Zahid Hamidi, over her alleged violation of the MCO, and will submit the investigation papers to the Attorney General's chambers once the probe has concluded. Police added that there should not be a perception that cops have failed to take action. A trader from a market in PJ has tested positive for COVID-19, forcing authorities to shut down the place. The popular Petaling Jaya Old Town Market has been ordered to close after a trader tested positive for COVID-19 on April 25th. The closure begins today and will remain closed for 5 days. All traders have been advised to undergo health screenings to be conducted at the market on Wednesday after a disinfection exercise is carried out. Petaling District Disaster Management Committee Chairperson Johari Abdul told Malaysia Kini that they were informed of the patient's test result yesterday. The trader had gone for screening on April 18th after having a high fever and tested positive for COVID-19 on April 25th. Johari said between the screening and obtaining the results, the trader did not come to the market. This is the second market in Petaling Jaya to shut down due to a COVID-19 infection after the Taman Megah morning market. Yesterday, Health Ministry Director General Dr Noor Hisham Abdullah said 60 traders at the Taman Megah market would be screened after one of the traders tested positive for the virus. Opposition MPs are not happy that the government food packs are purportedly not as valuable as advertised. Here's more on that. Pakatan Harapan MPs have questioned the value of food aid distributed to the poor affected by the movement control order. Lembah Pantai MP Fahmi Fadil said he received 250 food packs and each was worth 85 ringgit. According to the Malaysian Insight, Fahmi was told by the Welfare Department that the deduction for packing and transportation made it 85 ringgit and not 100 ringgit. Fahmi said that there were two types of food aid, 1,000 packs from the Finance Ministry worth 100 ringgit each for all MPs and 1,000 packs from the National Disaster Management Agency. He said that it was improper to deduct transportation and packing costs from the sum. Fahmi pointed out if 15 ringgit was taken from each packet for transportation and packaging, it would add up to a total of 3.3 million ringgit. He said a special parliamentary session was necessary so that the Minister in charge, Women and Family Development Minister, Rina Harun, could provide a clear answer to opposition MPs. On Friday, Defence Minister Ismail Sabri Yaakob had refuted allegations that the government is providing food aid not worth the budgeted 100 ringgit per pack. He had explained that those food packs under 100 are not from the government but distributed by NGOs. Other MPs such as Petaling Jaya's Maria Chin Abdullah, Rasa MP Chaki Chin and Bathus P. Prabhakaran had also questioned the food aid and said that the government should be more transparent with the aid distribution. A recent spike in online backlash against the Rohingya community in Malaysia has left our senior minister puzzled. So while the police try to get to the bottom of it, he's asking people to remain calm. Following a sudden spike in negative sentiments directed towards the Rohingya community in Malaysia, Senior Minister Ismail Sabri Yaakob has urged the public to keep calm as the police investigate the matter. During his daily press briefing today, he said the police are investigating the authenticity of various videos and audio clips which had gone viral on social media, linked to the backlash against the Rohingya community. He said he himself is puzzled by the sudden backlash since the presence of the Rohingyas in Malaysia did not happen overnight.
Jadi untuk sementara itu saya harap rakyat semua tolong bertenang. Tolong bertenang dan jangan timbulkan isu-isu yang boleh membangkitkan kemarahan yang akhirnya mesti mencetuskan sesuatu yang tidak diingini. Malaysia adalah sebuah negara aman, dan kita terkenal sebagai sebuah negara yang sangat bertimbang rasa kepada sesiapa saja yang berada di bumi Malaysia ini. Jadi saya harap kita tenanglah, kita beri peluang kepada pihak polis untuk menyiasat perkara-perkara yang ditimbulkan.
Since last week, social media platforms and live streams of press conferences featuring government ministers were flooded with comments calling for action against the Rohingya community, following purported comments made by Myanmar Ethnic Rohingya Human Rights Organisation Malaysia President Zafar Ahmad Abdul Ghani. To keep its passengers safe from COVID-19, AirAsia has implemented new policies. AirAsia Group has implemented new travel policies for its passengers in light of the COVID-19 pandemic. Passengers will be required to bring and wear their own face mask before, during and after their flight, as well as during check-ins and bag collection. AirAsia's Chief Safety Officer, Captain Ling Leong Thien, said that passengers without a mask will not be allowed to board the flight. Additionally, AirAsia has also revised its cabin baggage policy to facilitate social distancing, especially during embarkation and disembarkation. And they will only allow one piece of cabin baggage, not exceeding 5 kilograms per guest. According to Ling, this will help minimize unwanted contact between guests' baggage. There will also be temperature checks at different checkpoints, including the boarding gates, with floor markers at queuing areas, including check-in counters, kiosks to ensure social distancing is observed. Ling said cabin crews are required to wear protective equipment in the aircraft, including masks and gloves. He added that the production staff will be monitored according to COVID-19 guidelines, and cabin crew handling menu items will be required to wear disposable gloves. Coming up next, Boris Johnson is back to work. After a battle with COVID-19, UK Prime Minister Boris Johnson is finally back at work. UK Prime Minister Boris Johnson returned to his Downing Street residence on Sunday after recovering from COVID-19. Johnson has been recovering from the coronavirus at home after spending 3 nights in intensive care in early April. This news comes the same day that Britain surpassed the grim milestone of 20,000 total deaths related to the coronavirus. At the daily COVID-19 briefing, Interior Minister Priti Patel said that there was no date set for ending the lockdown and urged Britons to continue staying at home.
People should stay at home, protect the NHS and save lives. It is imperative that people continue to follow the rules designed to protect their families, their friends and their loved ones. This will continue to save lives.
Opposition Labour Party leader Keir Starmer said the government had been too slow to impose the lockdown, to expand testing and to get personal protective equipment to hospital and care home staff. In an open letter to Johnson, he called out the government to set out when and how an economic and social lockdown to slow the spread of the coronavirus might be eased. He said the government was falling behind the rest of the world by refusing to say more. The official number of deaths related to COVID-19 in hospitals across the United Kingdom rose past 20,000, while confirmed cases stood at 153,000. It was an exciting day for children in Spain as they were allowed to go out for the first time in weeks. On foot, with bicycles, skateboards and scooters, Spanish children went outside at last on Sunday, emerging from their homes for the first time after 6 weeks of living under one of Europe's strictest coronavirus lockdowns. The relaxation came as Spain, one of the countries worst hit by the global COVID-19 outbreak, registered its lowest daily increase in the coronavirus death toll in over a month. Under-14s were allowed outside for the first time since the government declared a state of emergency on March 14th and shut down most public life and economic activity. Children wearing protective masks strolled the streets of Madrid.
We appreciate being able to go out because staying at home, it was getting very boring. Even though we have the PlayStation and we can talk to our friends on WhatsApp and video calls, it is good to be able to go out and have some fresh air because we were feeling a bit overwhelmed at home.
Children will be allowed 1 hour of supervised outdoor activity per day between 9 a.m. and 9 p.m., staying within 1 kilometer from their home. Adults can accompany up to 3 children who will not be allowed to use playgrounds or share toys and must adhere to social distancing guidelines, remaining at least 2 meters from other people. Schools remain closed. On Sunday, Spain reported 288 more people had died after being diagnosed with the coronavirus, the lowest daily rise in the death toll in the past month. That brought the total number of deaths to 23,190, while the overall number of cases rose to over 207,000. Spain has registered the third highest number of COVID-19 deaths after the United States and Italy. Since the implementation of the MCO, many organizations have tried to do their part to help those in need. Let's see how Blue Air has played its part.
A total of 100 units of Blue Air air purifiers worth 188,000 ringgit were donated to the University of Malaya Medical Centre recently.
Well, the purpose is actually to donate some machines to be able to help to maybe allow us to help the patients or the frontliners to feel a bit more comfortable knowing that the air will be cleaner with Blue Air here.
This is part of the company's Visionary Solutions Corporate Social Responsibility (CSR) initiative, in line with the company's commitment to promote the importance of air purifiers and the ongoing efforts to help Malaysians, especially COVID-19 patients and the hospital frontliners.
In this case, that's what we need here, I think, because now that we know that the COVID-19 is also airborne, I think that's very important that not just we wash our hands and sanitize our hands and all that, wear the mask, but at the same time, I think the air needs to be taken care of. Yeah, that's where Blue Air comes in.
The sponsorship of the air purifiers is to aid the Ministry of Health existing efforts to ensure clean air in hospitals, which is not only to prevent pandemic viruses, but also ensuring the air is fresh and clean.
Well, Blue Air, we've always been advocating and always been talking about clean air, right? So even dust and all that is actually something that actually can affect our health. So when the environment is dusty, especially now today where there are even microplastics in the air, very, very fine dust, a lot more bacteria and viruses that we don't know about, right? And it's all around us. So I think in that sense already, as a basic, we should all have an air purifier. But now on top of this situation, of course, then I think it's more important to have, it's even more crucial that you have an air purifier right now. Yeah. So not just in an open environment like this, or it's actually just also at home.
And that is all for me today. For more stories, you can go to KiniTV.com. You can also follow us on Instagram, Twitter, YouTube and Facebook for the latest news updates. I'll see you again tomorrow, same time, same place. I'm Prasad Michael. Thank you for watching.